Now, class, let's discuss diabetes type 2. So here's a sample case, class. And allow me first to present to you, okay, the case. So first things first, class, you need to present the pathophysiology. So as I've told you a while ago, okay, I'll be giving you class specific diseases. Okay, may diagnosis na to, so huwag na tayo mag-alala. So you just need to present class the pathophysiology in a understandable manner. You don't need to go into too much detail. All right? Kasi again, we're not here to diagnose. And these are things, class, that I pretty much know na na-discuss nyo na in detail sa pharmacology. Okay? Pero anyway, class, what's the problem with type 2 diabetes? Oftentimes, class, nagkakaroon tayo ng abnormal insulin sensitivity. What do you mean by this? Okay, nagkakaroon tayo, class, ng insulin resistance. Meaning, ang patient ko, hindi na nag-respond ng maayos sa insulin. Remember, class, what happens or what's the usual cause of type 2 diabetes? Well, oftentimes, class, it's a metabolic disorder. Okay? Can be brought about by weight gain or physical inactivity, which leads, class, to insulin resistance. Ibig sabihin, do I have enough insulin? Yes. Okay? The problem is, my body is not responding to the insulin. The problem kasi, class, with type 1, ay try nga natin. Ano ba class ang problema sa type 1 diabetes?
Not enough po yung
Very
insulin.
good. Okay, very good. Diba sa type 1 diabetes, class, you're not producing insulin. You're not producing enough insulin. So hence, that's called type 1 diabetes. In type 2, class, so not enough insulin. In type 2 diabetes, class, you have what we call insulin resistance. Meaning, class, your body produces enough insulin, but your body is just not responding to the insulin. Alright? Okay, so what could be the reason for that? Could be so many things, class. It could be because you're taking in too much sugar. Okay? Could be genetic factors. Could be because of physical inactivity. Hindi ka nagiging active, so nangyari, class, hindi ngayon nag-respond hindi nag-respond na maayos, class, yung mga insulin receptors natin. Okay? High glucose intake. Isipin nyo, class, ganito yan, ha? If I increase glucose intake, mahilig ako sa matatamis, what do you think, class, will happen to my insulin production? Insulin production. Kung araw-araw na ginawa ng Diyos, class, kumakain ako ng isang malaking cake. Tapos ang panulak ko, 1 litro ng Coke. Ano mangyayari sa insulin production ko?
Tataas din po, sir.
Very good. Tataas talaga yung insulin production ko. Now, class, syempre, dahil paulit-ulit na mataas ang insulin production, ano nangyayari, class, ngayon sa insulin sensitivity?
Bumababa po.
Very good. Nagkakaroon tayo, class, ng decrease in insulin sensitivity kasi araw-araw na ginawa ng Diyos, mataas ang insulin levels mo. Di ba, class, pag araw-araw kang minamahal ng isang tao, minsan nagsasawa rin tayo. Diyos, may ganun? Okay, pero anyway, class,
naman.
pero kasi, di ba, too much of everything is bad. Okay, the point is, too much of everything is bad. Kasi nagkakaroon tayo ng desensitization. Okay, it leads to desensitization. Same thing, class, happens to our body. If we have too much insulin production, it causes now a decrease in insulin sensitivity, which causes now, class, insulin resistance. Now, pag naging resistant ka na, class, sa insulin, ano nangyayari sa sugar levels mo? If you have insulin resistance, then it causes an increase in glucose. Tumataas ang glucose levels natin, which again leads to type 2 diabetes. Basically, that's that. Okay? Now, of course, class, the insulin resistance can also be attributed to genetic factors. Pwedeng somewhere along your genes, you don't have, hindi ganun kadami ang napoproduce mong insulin receptors, halimbawa, leading to insulin resistance. So, kumbaga, meron ka namang insulin, you don't have enough receptors for it. Or, yun na nga, defective yung receptors natin for insulin. Which lead now, class, to impaired glucose tolerance, leading to diabetes. Alright? So, are we clear with this? Okay, of course, kasi it's more complicated than this, ha? It's more complicated than this. Pero sabi ko nga sa inyo, we just need an overview of the disease. You don't have to discuss it in too much detail. So basta basically class, what's the problem here? Okay, you're not responding to insulin. Now, sabi nga natin class, ano pa ang pwedeng cause ng type 2 diabetes? Pwede rin naman class, mababa ang insulin production. That could be another thing. Okay? Or pwedeng increase glucagon secretion. You still remember glucagon? Glucagon is the opposite of insulin. This one class cause increase in blood sugar. Blood sugar. Pwedeng central dysregulation of appetite control, meaning nagkakaroon ka ng increase in appetite, so kain ka ng kain. Insulin resistance is the most prominent reason. Pwedeng incretin effect, impaired incretin effect. Incretin class is this is a hormone that promotes insulin release. Okay? Normally, class incretins are found in the intestines. In the presence of food class, whenever we eat, okay, the intestines, pag may laman siyang pagkain, it starts to produce incretins, which calls for the production of insulin. Alright? Are we good? Okay, familiar ba kayo class sa mga gamot na DPP-4 inhibitors? Ever heard of these drugs? Sitagliptin, ganun. Sitagliptin, pa bang Vidagliptin, Januvia, narinig yun na yung gamot na yun? Have you heard of DPP-4 inhibitors?
Yes po, sir.
Okay. Na-discuss nyo na ba ito sa pharmacology? Anti-diabetic drugs? Na-discuss nyo na nga ba? Wait, sorry. Nag-pharmacology 1 na kayo, right?
Yes po, tsaka
Pharmacology 2.
2 po.
Tapos na rin.
Opo, sir. Tapos na po.
Alright.
Nabanggit naman po yung mga ganyan. Siltagliptin, vildagliptin.
Okay. So you're familiar with how DPP-4 inhibitors work, right? Okay. Pero sabi ko nga laging sa mga estudyante ko, class, sobrang dami ng inaaral nyo, imposible na i-expect naming mga teachers na maaalala nyo pa yung mga previous lessons nyo. Pero at least familiar. Okay, familiar. Okay. So at least you know, class, that it's a anti-diabetic drug. DPP-4 kasi, class, is an enzyme that destroys incretins. Okay? DPP-4, it's an enzyme, dipeptidylpeptidase 4. It's an enzyme that destroys incretins. So therefore, if I give you an DPP-4 inhibitor, like sitagliptin, vidagliptin, then obviously, class, nasa spare ngayon si incretin. Tandaan nyo, anong ginagawa ng incretin? It causes insulin release. So very important na i-protect natin si incretin. Okay? And it's a hormone class that appears whenever there is food in the gut. So it enhances insulin production. Right? So hepatic glucose overproduction, blah, blah, blah. Renal reabsorption. Okay? Ano nga ba to? Wait, let me just make sure. Yung gliflazine, yung mga gliflazine. Alright. So, gliflozin. Yon. So, class, you've heard of drugs like mga gliflozin? Alright. So, have you heard of these kinds of drugs, class? These are the SLG2 protein inhibitors. SLGT2 inhibitors. Narinig yun na ba to?
Yes po.
Alright. Ano nga bang ginagawa ka sa gamot na to? Mga gliflozins natin.
Hypoglycemic, ano po yun?
Okay, very good. It's a drug used for diabetes to induce hypoglycemia. Very good. Okay. Pero kas what this drug basically does is it prevents your body from reabsorbing glucose. Halimbawa, class, ang normal kasi na glucose threshold would be 190 grams per day. 190 milligrams per deciliter. Okay? Okay, yeah. So, 190 milligrams per deciliter na blood concentration. Kumbaga, class, at this point, pag ganito na yung sugar level sa katawan mo, dun pa lang inaalaw ni kidneys na ma-eliminate yung glucose. Kunwari lang muna to ha. Okay. Now class, if you use a glyphosines, yung mga SLG2 inhibitors, 100 milligrams per deciliter pa lang ang inyong blood sugar, it starts to secrete the sugar, the glucose in your urine na. So what I want to point out here, class, is that it prevents your kidneys from reabsorbing sugar. Okay? Kasi again, normally, class, the kidneys reabsorb sugar, right? It reabsorbs the sugar. So because you administer or you give an SLG2, this is sodium glucose co-transporters 2. By inhibiting this class, this transporter, you prevent the reabsorption of glucose. Okay? You prevent the reabsorption of glucose. So, are we clear? Ayan. Ayan. Okay? Okay. So anyway, what else? So increased lipolysis could be, could also bring about increase in your sugar levels. Wait lang, class, ha? Okay. Sorry about that. Anyway, so ayun. Okay. Now, class, let's talk about the signs and symptoms of diabetes type 2. So again, class, these are just the basic signs and symptoms of diabetes. Oftentimes sa mga class, makikita naman natin dito in terms of lab results would be an elevation in blood sugar levels or blood glucose levels. So polyuria, meaning excessive urination. Okay, increased hunger, polydipsia, inom ka ng tubig because your body is trying to dilute the amount of sugar in your blood. Okay, dark skin areas, this is mostly because of endocrine dysfunctions. Naapektuhan na yung hormone production natin. Feeling tired or drowsy or weak because you are no longer utilizing your sugar. Okay, tandaan nyo, class, ang problem with diabetes is hindi ko na magamit yung sugar ko. Okay? Actually, class, the increased hunger here is actually brought about, okay, by this results because you can no longer utilize your glucose well. Alright? Kasi, class, ano ba ang kailangan natin para ma-process ang sugar sa cells? Okay, for cells, class, to process sugar, it needs insulin. Just remember, class, ang insulin parang susi yan. Okay, kasi may mga glucose transporters tayo. If this is the cell, okay, glucose, class, cannot enter the cell alone. Okay? Kailangan niyang dumaan sa isang glucose transporter. We call this the GLUT4. Na para magbukas kasi, class, ang GLUT4 na yan, kailangan ma-activate si insulin receptor. Alright? Now, class, si glucose na yan, halimbawa, wala akong insulin or hindi nag-respond yung insulin receptors ko. So, si GLUT4 laging sarado. So, ano ngayon nangyayari sa cell na to? Dahil laging sarado si GLUT4, hindi siya nakaka-receive ng glucose. So, ano ngayon nangyayari sa glucose? Dahil hindi nagamit ng cell, it stays in the blood. Now, dahil walang magamit na glucose si cell, magrereklamo siya ngayon. Sabihin niya, hoy, ba't wala akong glucose? Hindi sa wala siyang glucose, hindi lang makapasok si glucose. So therefore, class, the brain thinks that your cells are not getting enough glucose, so tinataasan niyo yung hunger. Alright? And you feel tired, drowsy, or weak because your cells cannot utilize glucose. Okay? So dahil hindi siya, class, makakapag-utilize ng glucose, so anong dinadigest ngayon, or anong ginagamit ngayon ng body mo? Your body starts to utilize, class, your fat. Okay? It starts to break fats and converts them to ketones as an energy source. Energy source. Kaya nga, class, oftentimes you'll see weight loss in patients with diabetes. Okay? Kadalasan, yung iba dyan, lalo na type 1 diabetics. Okay? Especially the type 1 diabetics, nawawalan, talagang pumapayat sila, class. Because their fats are converted to ketones. Okay? Ginagamit siya as energy source. At least kasi with ketones, you don't need GLUT4. Nagagamit siya automatically ng cells. So leading to yun na nga, weight loss. Right? Irregular periods. Okay, well, that's true. Because again, may nagkakaroon ng hormonal change because of the excessive amounts of sugar in the body. And then class, yeast or bladder infections. You do know, class, that once you are diabetic, you become very prone to infections. One, because of the sugar, the amount of sugar in your blood. Okay, number two, class, pwede kasing impeded na yung circulation ng katawan mo. Right? Which prevents the circulation of antibodies or your immune system. And number three, class, because your sugars are no longer receiving sugar, your cells are no longer processing sugars properly. So, kulang sila sa lakas. Kulang sila sa energy. May energy gap sila. Okay, so mag-Milo na lang, no? Ba't ba naisip ko pa mga ganong bagay? So, class, may energy gap. The cells lack energy, so they cannot function properly. So, hence, wound healing as well, class, is also affected. Okay, because again, they don't have enough energy to process the wound healing or to protect your body from infections. So, clear ba yun? Okay, so kaya class, you get symptoms like this. Right? What else? Increased frequency urination, yun na nga, UTI, extreme exhaustion because you don't have enough energy. Ito, slow wound healing. Okay? Tingling or numbness of the extremities. Why? Nagkakaroon tayo class ng peripheral, naapektuhan na ngayon yung nerves natin. Okay? In terms of sending signals back and forth from to the brain. To and from the brain. Alright? Kaya nga class, yung tingling or numbness na to can bring about diabetic foot. You know diabetic foot? Familiar ba sa inyo, class?
Sir, di ba parang yung mga nangingitim-ngitim na po yung ganun?
Yes,
sa mga
true.
diabetic.
Okay, actually, class, diabetic foot starts off with a wound in your feet. Pwedeng in between, halimbawa dito. Okay, kumari, ito yung paa natin. So, pwedeng may sugat na maliit, ganyan-ganyan. Class, di ba kadalasan nga kasi, kapag meron kang diabetes, nagkakaroon ng neuropathy. Meaning, nawawalan ng sensation yung mga extremities. Daliri at saka yung paa. So, pag may sugat siya dyan, class, hindi naramdaman ng pasyente na may sugat siya, ano sa tingin nyo ang gagawin ng pasyente? Kadalasan, papabayaan niya lang yan, right? Pinapabayaan niya yung maliit na sugat. Minsan, class, yung maliit na sugat na yan, lumalaki. Okay? Di ba sabi nga na Brown Man Revival, maliit na butas, dumalaki, konting gusot, dumadami. O, di ba? So, maliit na problema, class, like maliit na sugat yan, pwedeng lumaki yon at maging gangrenous. Okay? Bakit? Kasi nga meron tayo slow wound healing. So, yung maliit na yan, pwede ma-infect. Na-infect, sabi nga natin, very prone to infections. Okay? Lalaki siya ng lalaki hanggang sa maging diabetic foot, maging gangrenous na siya. Okay, pwede siya maging gangrenous, class, lumaki yung sugat na yan na wala pa rin nararamdaman ng pasyente natin. So, ang ginagawa niya, pinapabayaan niya. Right? Kasi wala siyang nararamdaman. Yun na nga problema sa mga tao eh. Hanggat walang nararamdamang problema, hindi nila pinapansin. Alright? Kaya nga, class, it's important that for diabetic people, they always have to check their feet for possible injuries para ma-address agad. Okay? Yeah. Now, what are the complications associated with type 2 diabetes? So, we have the following, class. You can have problems in the eye, okay, diabetic retinopathy, glaucoma, cataract, stroke. Because when you have diabetes, class, just so you know, when you have diabetes, class, it makes you prone to atherosclerosis. And you know what happens, di ba? When you have atherosclerosis. Atherosclerosis could lead to the formation of atherosclerotic plaques. And these plaques, class, can rupture, causing the formation of blood clots. Now, you might be wondering, sir, what could cause my plaques to rupture? Increase in blood pressure. Alright? Kasi class, imagine nyo ito halimbawa, class, ang iyong blood vessel. Andito yung accumulation ng taba. Now, class, habang lumalaki yung taba na to, tandaan nyo, it won't cause complete occlusion. It's just going to cause partial occlusion. Pero habang lumalaki yung deposit ng taba na to, ano nangyayari sa lining na to? Kumakapal, numinipis.
Kumakapal po.
Okay, pwede rin yun. Okay, technically parang kumakapal siya, no? Pero yung lining na yung class, isipin nyo, parang ito. Okay, itong gloves na to. Now, class, kumari ito yung lining ng inyong blood vessel. So, habang lumalaki ito, gumaganyan siya. Ano nangyayari sa lining na to? Habang lumalaki,
Numinipis po.
luminipis. Actually, luminipis siya. Now, class, ito nga pala, common misconception or common madalas nating iniisip na kapag may taba sa ating arteries, akala natin, di ba, parang nade-deposit lang siya dyan. Yan, ito yung taba. Right? Actually, class, plaque deposits don't work that way. Okay? When plaques, class, grow, they go underneath your arterial linings. So, meaning, pumapasok yun sa ilalim ng arterial linings natin. Dito siya, nagde-deposit sa ilalim. So, nangyari, class, is duminipis yung arterial lining mo. Now, dahil manipis yan, pag tumaas ang BP mo, ano sa tingin mo pwede mangyari? Biglang tumaas ang BP. Biglang lumakas yung blood flow dito. Yeah, pa! Ano ang pwedeng mangyari?
Rupture.
Very good. Okay? Pwede itong pumutok kasi manipis na lang yung lining eh. So, konting kembot na lang, talagang puputok na siya. So, pag pumutok ito, class, ang problem is, it's going to cause clot formation. Kasi may sugat. Di ba? Kasi whenever na may sugat tayo, okay, it causes the formation of clots. So, yan, tama yung nag-rupture, pumutok. Dahil pumutok, may sira. Di ba? May exposure ng, Van der Waals, von Willebrand's factor. Okay, kasi nagkaroon ng rupture sa tissues natin. So, which causes platelet aggregation. And this is going to cause the formation of clot. Now, kung yung clot na yan, class, na buo sa isang artery ng puso natin, kalalabasan niyan is MI. Kung sa utak yon, stroke ang kalalabasan nun. Correct? Okay. Class, what causes, isa sa mga major causes of atherosclerosis is diabetes. Did you know, class, that the fat that deposits underneath our arteries, hindi raw yan galing sa fat na kinakain natin. It actually comes from the sugars that we eat. Majority, I'm not saying all. Kasi, class, whenever we eat fatty food, most of that fat, class, actually goes into the adipose tissues. 80 to 90% will exist as triglycerides and will deposit itself in the adipose tissues. Okay, only 10, 20, or 10% class can be processed and be converted to VLDL, or what we call the bad cholesterol. On the other hand, class, the sugars that we consume, okay, if it's not processed, class, it can undergo beta oxidation in the liver, which converts the glucose into fatty substances, which can be converted into LDL. And again, class, majority of the atherosclerotic plaques that we have in the body are actually sugars converted into fats. Okay? Kaya hindi masama, class, kumain ng matatabang pagkain. Not unless mataas ang triglycerides mo, ha? Don't get me, Kasi talagang tataas ang triglycerides mo if you consume too much fatty food. Alright? Pero, class, talagang tataas ang LDL mo, diba? Lipoprotein, low density lipoproteins, okay, kapag mataas din ang sugar levels mo. Alright? So, ayun. Anyway, so nerve damage, class, brought about by increase in sugars in the body. Renal failure, obviously. This renal failure, class, can again be attributed to atherosclerosis as well. Okay? Kasi bumababa yung blood flow to the kidneys. Right? I know I shouldn't be discussing this. Feeling ko alam nyo na to. Pero sige, review na lang, class. Okay? Parang review na lang sa inyo to. Okay? And then, of course, diabetic foot. Alright? So, just so you know, class, my passion is with cardiovascular pharmacology. Okay? Ito yung pinaka-paboritong topic. Right? Anyway, so, this is pretty much it. So, which leads to so many complications. Pwedeng mabulag ang pasyente, pwedeng magkaroon ng kidney failure, pwedeng magka-heart attack, pwedeng magka-stroke. Major risk factor, class, for strokes and heart attacks will always be the presence of diabetes, or for a patient having diabetes. Okay, because nga of the atherosclerosis associated with diabetes. Now, ano ang clinical practice guide na gagamitin natin? Obviously, class, we will be using, in my case, okay, I chose the clinical practice guidelines provided here in the Philippines. Now, remember, class, last time I told you guys na I'll be providing you with the clinical guidelines para pare-pareho tayo. Na-realize ko bigla, class, I am going to limit you to the clinical guidelines that I think is correct. Right? So, class, when it comes to clinical guidelines, again, you are free to choose whichever clinical guidelines you think is good. Alright? Para, class, ma-realize nyo kung maganda ba talaga yung isang clinical guidelines o hindi. Okay, kaya nga nag-activity tayo, class, on how to appraise a clinical guideline so that you'll know which one is better. Or kung may makita man kayo, kung feeling nyo ba maganda ang clinical guideline na to, na i-apply sa case na ibibigay ko. Alright, sa akin pa rin magagaling yung case, class. Pero yung clinical guidelines, again, I give you the freedom to choose whichever clinical guidelines you think is best. Okay? Which is best for you. All right? Sorry, another ano kasi. May isa pa akong work. Ay, naku. Ayan. So, are we clear, class? Okay, so yun.
Yes po.
Thank you. So, in my case, class, I'm using the Philippine Clinical Guideline. So, here's my case. NH is a 54-year-old man with type 2 diabetes who comes to the pharmacy reporting that he has fluctuating glucose readings. So, pwedeng dito pa lang, ito yung main problem ko, may fluctuating glucose reading siya over the past 3 months. So, with some readings greater than 200 milligrams per deciliter, and sometimes it's below 70 milligrams per deciliter. Okay? His most recent glycosylated hemoglobin level was 8%, in contrast to his previous value of 6.9%. Okay? Although papakita ko mamaya class kung anong relevance ito, pero kasi the ideal glycosylated hemoglobin class should be less than 7%. Okay? So yung dati niya 6.9, pwede na to eh. Pero bakit bigla ngayon 8% na tumaas yung kanyang glycosylated hemoglobin after 3 months? Okay, tapos ito pa, nagpa-fluctuate pa. May 200, may 70. He says he has had consistent meal intake. Okay, ibig sabihin, normal naman daw ang kain niya. And has been on the same dose of his prandial and basal insulin during this time period. He keeps a diary of his daily meals and glucose readings, and it is apparent that he performs his blood glucose testing consistently. Okay. So, consistent naman daw ang kanyang pag-record ng kanyang blood sugar in regards to meals and at approximately the same times each day. For his diabetes management, he is taking metformin, 1,000 milligrams twice daily. Okay, insulin glargine, 30 units at bedtime, and insulin aspart, 10 units 3 times a day. So you do know, class, that glargine is a long-acting. So si aspart naman, class, is short-acting. So obviously, between the two, ito yung ginagamit niya as basal insulin. Meaning, this is the insulin glargine yung ginagamit niya to sustain the amounts of insulin throughout the day. While yung insulin aspart niya yung ginagamit niya for prandial, as prandial insulin. Meaning, yung amount of insulin na kailangan tumaas, the amount of insulin that the patient needs kapag siya ay kumakain. Okay, yung prandial insulin niya. So, on further questioning, NH reveals that he injects his insulin somewhere different with each administration, saying he thought he was supposed to rotate the injection sites. Okay? So, here's the case. Now, what are the subjective information dito? Okay, in my opinion, okay, the way I see this class, ako lang naman kasi ang gumawa nito. That's why it's important kasi you have other people, okay, with you when you're making a case study. Pero some people do this by themselves, wala nyo naman problema. Especially if you have experiences naman na. So, ang information na kuha ko, sabi niya raw, nagpa-fluctuate. Okay, kasi nanggaling to sa patient natin eh. So, had fluctuating glucose readings. Right? So, according to him, he had consistent meal intake din naman. Okay, and has been on the same dose for prandial and basal insulin during this time period. He injects insulin somewhere different. Okay? Somewhere different with each administration. So, ibig sabihin, class, palipat-lipat yung saksak niya. Okay? Ang saksak niya ng insulin. Saying he thought it was supposed to be to rotate the injection sites. Okay? As to objective information, so 54-year-old, okay, mayroon na akong diagnosis, which is type 2. And then, consistent yung meal intake niya. Okay? Lab test. Sabi niya dito, for the past months, meron siyang sugar levels. Yung kanyang sugar levels, pabago-bago. May mga panahon na more than 200, may mga panahon na less than 70 pa. Okay? Pero class, ito yung palatandaan natin na hindi niya nakokontrol ng maayos ang sugar niya. Tumaas yung kanyang glycosylated hemoglobin levels at 8% as compared to 6.9% before. And the medications niya are as follows. Metformin, 1,000 mg twice daily. Okay, insulin niya, ito yung units, and so on and so forth. 15 minutes before meals. Okay. So now, class, let's try to assess the patient here. Now, normally, class, when I assess a patient, I start with the objective ones before I go to the subjective ones. Okay? So, ang problem list na nakita ko dito is, based on the findings or based on the patient, okay, ang pinaka-problem niya is yung fluctuating glucose readings niya, right? And then, of course, another one that would mark that would be the increase in his glycosylated hemoglobin. So, number one ko dito klase kailangan i-address is yung fluctuating glucose readings niya. So, anong possible reason bakit nagpa-fluctuate ang kanyang glucose? Kayo nga muna, tanungin ko muna. Sa tingin nyo, ano mga pwede nating tingnan na anggulo? Okay? So, balikan natin yung kanyang dito muna tayo sa objective information. So, alam ko ang problema ng patient ko is yung fluctuating glucose niya. Ano ang mga pwedeng anggulo na tingnan natin? Okay, bakit kaya nagpa-fluctuate yung kanyang glucose? Sa tingin nyo lang, class,
Meal intake, sir.
Sorry, Mr. Kian?
Yung meal intake po.
Meal intake. Okay. Ano sa meal intake? Pwedeng pabago-bago? I guess pwede, pero minention niya na kasi dito na consistent naman daw yung meals niya. Okay, ibig sabihin, he's following whatever the nutritionist recommended him to take. Okay, if you notice ka sa guidelines natin, di ba? It's one of the non-pharmacologic the management would be the meal intake. Specific pa kung gaano karami ang kakainin natin eh. So, pero pwede rin yun, tama yun, Mr. Kian. Lalo na kung hindi sinabi yung meals, pwedeng angulo yun na pwede natin tingnan. Okay, baka mamaya, minsan marami siyang kinakain, minsan konti siyang kinakain. So, tama yun, Mr. Kian. Pero in this case, okay, na-state naman kasi raw na consistent yung meal intake niya. So, pwede nating i-cross out as part of the reason. What else, class? Pwede nating tingnan. Ano pa mga angulo ang pwede nating tingnan dito?
Pero siguro magtingin ko may DTR, drug therapy.
Okay, baka may problema, tama. Baka may problema sa gamot niya, right? Okay, baka may hindi pala maganda yung gamot niya. Correct? Or yung dosing niya, pwedeng mali. So, pwedeng may drug therapy problem tayo. Very good. Kasi as a pharmacist, automatic din. Ang unang ko titingnan is medications. Hanap ako ng drug therapy problem dyan. Okay, meron pa ba tayong pwedeng tingnan na anggulo? May naisip pa ba tayo?
Medication adherence, sir.
Sorry, Mr. Kian?
Yung medication adherence ng pasyente ko.
Okay, yung adherence niya? Alright? Baka mamaya, chorba-chorba lang pala sinasabi niyang masunurin siya. Okay, pwede nating questionin yun, right? Pero, again, wala kasi talaga dito yung patient natin. So, we have to make do with what we have in our case. Assuming, class, that everything that was stated in this case is true. Okay? Pero sabi ko kasi, in real life, we can always ask the patient. Okay? Pero again, we are at the mercy of the information that we have right now. Kasi wala naman tayong pasyente talaga na totoo dito eh. It's just a case. Alright? So we have to work with what we have right now. Now, ang assumption natin ngayon is, okay, consistent ang meal intake. Alright? Assuming na maayos naman ang paggamit niya ng gamot. Okay? So ngayon, ang next na angulo titingnan ko dito, obviously, class, titingnan ko yung drug therapy niya. Okay? Maghapa ako ng drug therapy problem. Kaya ano kaya ang possible reasons ba't nagpa-fluctuate yung kanyang glucose? So, first things first, ang glucose niya ba ay maayos naman? So, based on the guidelines, class, di ba sabi dito, glycemic targets must be individualized. Targets HbA1c should be less than 7%. So, obviously, class, ang patient natin nasa 8%, which is higher than 7%. So, wala tayo sa target niya. 3 months na yung treatment, right? 3 months ang treatment, dapat within the goal na siya eh. So, what else? Ang kanyang, tawag dito, postprandial blood glucose, di kasi sinabi kung is this before meals or after meals. So, kung sakali naman kasi class, kung fasting yan, meaning before meals, dapat it should be within 90 to 130 milligrams per deciliter. Now, kung after meals naman, it should be less than 180. In this case, it's 200, which is above 180 milligrams per deciliter. It's already above. So obviously, class, hindi niya nakokontrol yung sugar levels niya. Mataas masyado. Okay? So what else? Sabi nga natin, yun nga, 8% ang kanyang glycosylated hemoglobin, dapat it should be less than 7%. Dati nakukuha niya na eh. Pero bakit nagpa-fluctuate? So tingnan niyo rin, may mga times na less than 70 milligrams ang kanyang sugar level. So, bakit may mga times na mababa? Bakit may mga times na mataas? Right? So, may legit concern tayo dito ngayon. Now, looking at possible drug therapy problems, so titingnan ko muna, maganda ba ang gamot na ginamit sa patient natin? Alright? So, patient natin class using metformin, right? Now, sabi nga sa guidelines, okay, among the newly diagnosed diabetics, alright, oftentimes class, treatment, okay, treatment should be, saan ba yun? Okay, ba't wala dito? Anyway, so, you have to check class kung kailangan na ba talaga ng treatment. So, obviously, our patient would require treatment. And then, the glycemic targets class should be reached within 3 months. Okay? Especially kung, okay, pag 3 months na wala pa rin yung glycemic goals natin, then you really do need pharmacologic treatment. Alright? So, therefore, ayun. So, one of the main drug class na magandang gamitin daw or umpisa ng isang patient with type 2 diabetes is metformin. Okay? So, it's best to start with metformin. So, mukhang check naman ito. So, mukhang okay naman yung metformin natin dito. Now, class, another concern ko dito is looking at the dose of metformin. Nakita natin, it's 1,000 milligrams. So, technically, parang sinagad niya yung patient, right? So, sabi ko, hala, pero kahit nakasagad na, ba't di pa rin nakokontrol yung sugars? So, anyway, class, upon looking at the max dose of metformin, right? So, ang max dose niya kasi, class, is 2,550 milligram per day. Looking at this dosing class, it's 1,000 milligram twice daily. So, 2,000 milligrams per day si patient. So, technically, pasok pa rin naman siya sa max dose natin, right? Okay, it should be divided every Q8 or Q12 daw. So, twice a day naman to. So, ibig sabihin, Q12 ang dosing natin. So, mukhang goods pa naman. Okay, goods naman yung dose niya for metformin. Now, next one class na tinitingnan ko dito would be the insulin dosing. Okay? In terms of insulin dosing class, importante kasi dito na may weight. Alright? Wala akong weight sa information ng patient ko, so I can't compute for the right dose. Right? Kasi based on the clinical guidelines class, ito yung formula to compute for your basal insulin as well as yung starting dose natin. Okay? Wala tayong weight, so wala akong magagawa. Okay? Alangan mang pilitin ko na maglabas to ng weight. Wala tayong weight eh. Anyway, so wala na akong magagawa dyan. Okay, so the next best thing class is how should you dose or how should you know if you need to change the dose of insulin? So luckily class, in the clinical guideline na binigay na ginamit natin, okay, may nakasulat doon na aspect doon where for patients on insulin, should the patient adjust his insulin? Alright? Ang sabi dito class is, if blood glucose, okay, if blood glucose is less than 230 milligrams per deciliter, yung pinaka-highest dose daw, yung pinaka-highest glucose levels na record niya, okay, it means you need to continue with the current dosage. Again, ano ang pinaka-highest glucose reading ng patient natin so far?
200 po.
200, which is less than 230 pa naman. So, ibig sabihin nito, class, I can stay or I can keep yung current dose na ginagamit ng patient ko. So, right now, I'm looking at this, sabihin ko, parang wala namang mali sa gamot niya. Okay, wala akong nakikitang mali. Personally, baka kayo may nakikita kayong mali. May nakikita ba kayo, class? Kasi ako lang naman ang nag-assess nito eh. So, you might have are you seeing any other problems? Any possible problem? Okay? May nakikita ba kayong possible problem in terms of medication, lab test, ganyan-ganyan? Na pwede pang attribute sa kanyang fluctuation ng glucose levels niya. Kasi right now, in terms of dosing, nasa ganda si metformin. So, tama naman, hindi naman sobra, hindi naman kulang. Okay, as to the dosing of insulin, alright, based on the guidelines, alright, we can keep the current dose. Okay pa naman daw yan. Okay. Alright. So, parang wala pa naman tayo nakitang mali, right? Tama nga ba? Okay, pero baka kasi may opinion kayo, class. We are very open to your opinions. I would like to hear your opinions. Sabi nga nila, 2 heads are more than 1. Tama ba yun? Actually, 2 heads are better than 1. Right? So, any other opinion? Okay. So, tandaan nyo, class, every decision I'm trying to make here is supported by a guideline. By the guideline. Or, meron tayong may support tayo. Okay, may journal support tayo. Right. So right now, class, looking at this, parang wala akong makitang problema sa kanyang treatment. Okay? Now, what could be another reason bakit nagpa-fluctuate ang kanyang sugar levels? So hence, class, I went back now to eto. Ang next ko naman kasi tingnan dito would be 15 minutes before meals niya. Kasi, ang naalala ko sa school, ang turo sa akin lagi noon, nung topic namin is diabetes, is that the insulin class should be administered 30 minutes before meals. Correct? Yan din ba ang turo sa inyo? That insulin should be administered 30 minutes before meals. Was that the same same thing na sinabi sa inyo before? Kasi raw it takes about 30 minutes before a insulin works, before it's absorbed, especially yung mga rapid acting natin. Okay, so yun ang inisip ko ngayon. Sabi ko, baka kasi dahil dito 15 minutes before meals siya in-administer. So I was looking, class, at some guidelines on how to use insulin. So this was a paper published kasi by the American Diabetes Association. Medyo matagal na nga to, 2002 pa to eh. Okay, pero wala na akong makitang ibang guidelines on the proper use of insulin. Now, based on their guideline kasi, class, insulin aspart is rapid acting insulin. Okay? Based on the guidelines, class, ang sabi dito is rapid acting insulin analog should be injected within 15 minutes before a meal or immediately after a meal. Kasi lagi kong tinuturo sa mga pasyente ko, 30 minutes before eating. Eh, minsan nakakalimutan nila, di ba? So, at least daw, kahit right after the meal, pwede na silang magsaksak. Okay? So, that's based on our guideline here. Interval between injection. Now, for short-acting naman kasi, ito yung 30 minutes. For short-acting. That's regular insulin. Kasi ako dati, ang tinuturo ko lagi sa mga pasyente ko, kahit anong insulin pa yan, basta before meals, it should be 30 minutes before meals. Now, yung before meals na yun pala, applicable lang sa mga regular insulin natin. If it's a rapid-acting insulin class, kahit 15 minutes lang, pwede na, or right after you eat. Insulin aspart is a rapid-acting insulin. Right? So, with that in mind, sabi ko, ay, okay, hindi pala problema ang pag-administer niya yung sa timing na pag-administer niya ng insulin. So, that's not the case. Alright, so in this case, class, na-exhaust ko na yung possible problems na pwede kong makita in terms of the medications used. Alright, so parang wala namang problema sa medication niya. Okay? Now, with this naman, class, okay, dahil tapos na ako sa objective information, wala akong makitang problema eh. Next na titingnan ko would be, of course, the subjective information. Actually, binigay ko na pala sa inyo yung slides, no? Hindi ko na pala binigay ito. Anyway, ang isa naman natin dito, class, is according to the patient, he injects his insulin somewhere different with each administration. So, ibig sabihin, class, paiba-iba ang site of administration niya. Saying that he thought he was supposed to rotate injection sites. Now, class, do you agree with this? That you have to rotate the injection site? Do you agree? Kapag gumagamit tayo ng insulin. Do you guys agree? Okay. Yes, Miss Sarah.
Pwede naman po, sir. Yes po.
Okay, bakit dapat i-rotate?
Ano ba yun? Kasi sir, syempre, di ba parang kung same spot lang din lagi, pwedeng maging uncomfortable po yun sa patient.
Okay.
Kasi masakit din po yun.
Very good. Now, whenever we yes, Miss, sorry.
Sir, napanood ko rin po kasi sa YouTube nun kasi yung friend ko po nagtanong sa akin since yung papa niya po ay naggaganyan din po. Tapos, ayun po, sa iba't ibang part po ng tiyan, ina-administer yung insulin kasi masakit daw po talaga kapag dun lang sa mismong lugar.
Okay. Pero sa tiyan lang siya nag-administer, right?
Opo.
Okay, very good. Kasi ito yan, class. Some patients, totoo to, na-experience ko na to eh. Some patients, class, pag sinabi mong rotate the injection site, tatanungin nila, saan ba mga pwede mag-inject tayo? Siyempre, sasagutin natin. Common po sa abdomen, pwede rin naman sa forearm, dito. Pwede rin sa thighs, pwede sa buttocks. Okay? Some people, class, when you say na i-rotate ang injection site, as in literally, isa sa umaga sa tiyan, sa susunod na ano, sa hapon, sa hita. Okay? Sa gabi, sa may puwetan. Right? Some people, class, interpret it like that. Okay? Now, class, remember, when we rotate injection site, it's still within one area. Kung abdomen, abdomen lang. Right? Iikot lang sa may abdomen mo ang injection natin. Correct? So, ito, class, yung nakita ko ngayon problem. Right? Or one of the problems that we might actually consider. Because the patient might be injecting it at different site talaga. As in, literally, forearm, puwet, tiyan, and so on and so forth. Okay? So, that's one thing, class. Now, if we go back, class, to the position paper, or yung pinublish ng American Diabetes Association, in terms of injection site, class, you can see here, ang sinabi nila, so yes, tama yun, dapat i-rotate ang injection site. Okay, rotating injection sites within the abdomen rather than rotating to a different area with each injection. So, ibig sabihin, class, hindi mo pwedeng i-rotate yung area kung saan ka mag-i-inject. Right? This practice kasi may decrease variability in absorption from day to day. Site selection should take into account consideration the variable absorption between sites. Remember, class, each site of administration may produce varying absorption for insulin. Like halimbawa, class, the best site daw, based on this paper, is the abdomen. This one provides the fastest rate of absorption. Next dyan would be arms, thighs, and buttocks in decreasing order. So, ibig sabihin, ang pinakamataas ang absorption, okay, ng insulin would be sa abdomen. Followed by the arms, next ang thighs, pinakahuli, class, or pinakapurong absorption sa buttocks. Okay? Pero pwede ka pa rin mag-administer ng insulin doon. Pero yun nga lang, yun yung pag-decrease. Yun yung tawag ito. Bawat sites will have different rates of absorption. Yun na lang. Na, kung sakali ka, halimbawa, sinabi na naman dito okay, pag mag-administer daw tayo within, sa abdomen, it should be 2-inch radius around the navel. Ibig sabihin, 2-inch away from the navel, away sa pusod. Okay, doon tayo mag-i-inject. Pwedeng paikot doon. 2-inch away from the navel. Now, another thing, class, hindi kaya nasama dito na kapag nag-administer tayo, class, ng ng injection, so kung sa abdomen lang, like say for example here, so it should be again 2-inch apart away from the navel, or pwede, class, isang area lang, pero dapat 1 inch apart of each other. Okay, at least 1 inch apart. Okay? From each other. Kung isang area lang ng abdomen ang gusto mong gamitin. Now, again, class, pwede naman paikot sa buong abdomen. Okay? At least 2 inches apart. Okay? At least 2 inches apart. Okay? Okay. So, ayun. So, are we good? Okay. Now, so ang problem is ko ngayon dito, class, would be, ang nakita ko ngayon dito would be inappropriate adherence. Why? Kasi nga, class, mali yung kanyang way of administering insulin. Right? Now, it should not be from different parts of the body. It should just be within one area, pero rotating within that area. Okay? So, therefore, class, one of the drug therapy na nakita natin, or in my case, nakita ko dito would be inappropriate adherence. You might have seen some other na hindi ko nakita. Just let me know. Right? So, what's now my plan? Okay? So, we can suggest class NH to keep his injection site consistent for each type of insulin he is injecting. Okay? So, insulin glargine, class, may be administered at the arms or thighs because of the slow absorption of the of that site. Kasi insulin glargine, again, class, is used for as your basal insulin. Ibig sabihin, ito yung insulin na kailangan throughout the day mataas. I mean, ito yung magpo-provide ng insulin sa katawan ng patient natin. Okay, while insulin aspart, which is rapid acting, should be administered in the abdomen for fast absorption. Okay? Now again, class, rotate injection sites within the general area with sites separated by 1 inch or more to prevent lipohypertrophy. So according sa natin, yun yung iniiwasan kasi natin dito. So, ito. To prevent lipohypertrophy or yung pagtaba ng paglaki ng taba na tinutusok-sukan natin. Okay, so make sure patient NH knows how to administer subcutaneously. Baka mamaya ang problem pala dito is hindi marunong mag-inject si patient natin ng subcutaneous. Ginagawa niyang intramuscular. Again, class, hindi recommended na intramuscular. Saan ba yun? Based on this guideline, class, saan ba yun? Ayun, intramuscular injection is not recommended. Okay? Kasi minsan baka mamaya intramuscular yung pag-administer. How do we administer subcutaneously, class? You're still familiar on how to administer drugs subcutaneously?
45 degrees, sir.
Very good. Should be at a 45-degree angle, class. Tapos, ang importante dito is, pinipinch mo yung skin. The skin should be pinched para ang ma-isolate natin, class, is the subcutaneous area lang of the body. So, make sure lang, class, that patient NH knows how to administer yun nga subcutaneously. Okay? And then, always watch out, class, for signs of hypoglycemia. Okay? Because we've seen nga, nagpa-fluctuate yung kanyang sugar level. So, that's one thing, class, that you have to inform our patient. Okay, most likely, informed na rin naman siya dito. Pero again, just reiterate lang what are the possible signs of hypoglycemia. Let's say, for example, yung panginginig. Okay, or pagkahilo. Those are classical signs, class, of hypoglycemia. Okay? So, a change in patient's glucose level should be observed within 1 to 3 months or 3 months of using it. So, dapat, class, after 3 months, most likely, may makikita na tayong pagbabago sa kanyang glycosylated hemoglobin or yung pag-fluctuate ng kanyang sugar levels. Alright? So, yan. Kasi again, ang possible fluctuation ng kanyang sugar levels could have been attributed to the rotation in the site of administration. Kasi again, various sites of administration, class, can have different absorption rates, which could affect sugar levels din ng patient natin. So, once again, class, so, again, we'll always watch for hypoglycemia, especially with the treatment. And then, class, you will see relief or magkakaroon ng observable effect, class, ang patient natin should be within 1 to 3 months. Now, if nagkaroon pa, pag hindi pa rin, class, nagbago yung kanyang sugar levels, then obviously, class, there's a problem na here. Okay, pwedeng kailangan na palitan yung treatment niya or approach natin sa pag-manage ng kanyang sugar levels. Okay, pero for that time, class, ibang drug therapy problem na yun. Okay, so for now, hanggang dyan lang tayo. So what are some of the lifestyle modifications that we can give or we can suggest? Obviously, class, one of the best way kasi to manage sugar levels, class, is really lifestyle modification. Okay, very manageable, class, ang type 2 diabetes. Diet is number one factor here. Okay, if you diet, class, if you eat right, okay, it's going to cause a significant improvement in your blood sugar levels. Exercise, definitely, class, a daily exercise of 30 minutes. Sa panahon ngayon, mahirap siyang gawin. Kasi lahat tayo nasa bahay lang eh. Okay, pero class, it's very important that we get exercise. At least 30 minutes a day. If the patient is a smoker, stop smoking. Maintain your ideal body weight and class, get enough sleep. Why? The thing kasi, class, with our sugar levels is it's very reactive, class, to our how do you call this? Status ng ating pag-iisip. Whenever we're stressed, class, tumataas talaga ang sugar levels. That's true. So whenever you don't get enough sleep, don't get enough rest, class, tumataas kasi yung cortisol levels natin. Are you familiar, class, with cortisol? Ever heard of this hormone?
Pamilya na po, sir.
Okay, you've heard about this, right? It's what we call actually, class, a
Stress hormone.
Very good. It's a stress hormone, class. This stress hormone kasi, class, is responsible for increasing our sugar levels. Okay? Napapataas ito ang sugar levels natin to meet the demands of our stress. Kasi kailangan natin ng energy eh. Kaya, class, whenever you are stressed, talagang tumataas ang sugar levels. Normal yun. So if you don't get enough sleep, class, ang tendency is tumataas din ang cortisol levels natin. Which could elevate your sugar levels even further. Alright? So hence it's important, class, that we suggest or we inform our patient to always get enough sleep. Try to avoid stress hanggat kaya. Kung hindi, wala tayong magagawa. Okay? Pero at least we recommended it. Alright? Okay. So class, the case presentation, technically, class, won't even last more than 30 minutes. Right? Okay, kasi, again, important details lang kailangan natin i-point out. Ang kailangan ko sa inyo kasi dito, class, is ma-identify nyo kung ano yung mga possible drug therapy problems. Hindi ko sinasabing makita nyo lahat. Okay? Sometimes kasi we tend to neglect some things, right? Especially kung kulang ang information na meron tayo. Okay? Pero what I want you to develop here, class, is your ability to detect possible problems. I'm not saying all, and how to manage them. Okay, yun lang naman importanteng matutunan yung class sa class na ito. How to manage problems that you see. Okay, again, class, these are things you don't really learn a lot in school. These are things you learn in real life. Pero at least, class, in school, we try to prepare you for these kinds of problems. And we try to prepare you, class, to be critical thinkers. Okay? Na huwag maniwala sa lahat ng nababasa niyo. Hindi lahat yan, class, ay totoo. So you need to apply critical thinking to make sure that what you're reading, class, or what the information that you're providing is legit and accurate. Because one of the major roles, class, of pharmacists is to provide information to our patients.